Hi everyone, I'm Michelle McDonald-Werstuck and I'm a registered dietitian and nutrition groups coordinator at the Hamilton Family Health Team. And I'm so pleased to speak with you today about nutrition for healthy aging. So as I mentioned, I'm part of the Hamilton Family Health Team, which is a very large team that services over 300,000 residents of the Hamilton and surrounding areas. And on our teams, we have physicians, nurses, nurse practitioners, dietitians, mental health counselors, psychiatrists. We also have physiotherapists, quality improvement, and IT support, as well as our admin teams. So today we're going to talk about some topics that are important for senior health, why healthy eating matters for seniors, what are some of the common issues we see around malnutrition and nutritional deficiencies, what are some screening tools that you can use in your settings to identify seniors at risk that may require additional support, and some of the nutrition basics for planning healthy meals and healthy eating in general for older adults. So let's get started. So healthy eating is important for many reasons. It helps provide nutrients for both our body and our brain, helps give us that energy and fuel we need to feel energized each day, but it's also an important therapy for both prevention of diseases and management of many of the common conditions that we see. Things like preventing and managing diabetes, as well as hypertension and heart disease, and very importantly for seniors, nutrition is quite key for falls prevention, as well as managing GI symptoms. And there's exciting research showing that what we eat also matters for our mental health. So when it comes to heart disease, what we eat can make a difference and can reduce the risk of cardiovascular disease events by up to 28 to 30%. And current Canadian cardiovascular guidelines recommend that all individuals are offered advice about healthy eating and activity and adopt some of the components in these healthy eating styles, such as the Mediterranean diet. Healthy eating also matters for our mental health. Nutrients that we consume are important to produce neurotransmitters in the brain that are important for brain health. Things like serotonin and dopamine are neurotransmitters that we need to have energy and feel good, get enough sleep, help manage our mood and emotion regulation. And evidence shows that certain healthy eating patterns as well are associated with lower rates of cognitive decline and slower rates of conversion to Alzheimer's. In addition, they may offer some benefits on memory and executive functioning in terms of decision making. So why else is good nutrition so important as we age? Well, our nutrient needs begin to change as we age, and we need more key nutrients like protein and fiber, as well as calcium and vitamin D and B12. And as well, we need less of things like sodium as our kidney function may start to alter as we age. As well as we want less unhealthy fats, we want to ensure we're getting the heart healthy fats. In addition to nutritional needs changing as we age, other conditions may arise, which makes healthy eating a bit more complicated. Sometimes our seniors are following multiple different recommendations. They may have irritable bowel, diabetes, hypertension, and trying to manage all of those dietary changes can be a bit overwhelming. In addition, many of our seniors are on medications, and many medications have nutrition-related side effects that we have to be mindful of and help manage. In addition, GI changes happen. There's slower transit through the gut, they're more prone to constipation, as well as upper muscle changes in the neck and shoulder area can start to affect the safety of swallowing. You might also notice with the older adults you work with or the seniors in your lives that their appetite may change. They might get full quite quickly, not able to finish the meals they normally would eat. They may have more fatigue, and that may impact on their interest or ability to actually prepare foods, and you may start to see a shift into more reliance on processed foods or meals that are not quite balanced, like tea and toast, for example. And again, as I mentioned, the GI changes can start to really affect appetite as well. For example, constipation can really dampen appetite. So what is the hidden impact of a poor diet? Well, over time, if there's inadequate nutrients being consumed, you can start to see changes in physical change in the body, loss of muscle, for example, unintentional weight loss. Patients may report they have lower energy than normal. Again, the muscular changes can start to lead to challenges with balance. You may see increased risk of falls. And again, this can actually lead to a loss of independence if individuals are starting to fall and aren't safe on their own. So malnutrition and frailty and falls are highly linked, and malnourished seniors are much more likely to fall. In fact, the evidence quotes 73% more likely to fall than a well-nourished senior. And when it comes to hospital admissions, there was a large Canadian-wide study that looked at admissions, and they screened adults on admission, and 1 out of 2 adults were flagged as malnourished on hospital admission. And malnutrition is actually linked with longer hospital stays. It's actually linked with worsening during the stay and a higher 30-day readmission rate, meaning they've been discharged, but if the malnutrition is not addressed, they tend to be readmitted within that 30-day time span. So let's switch gears to nutritional deficiencies. What are some of the common deficiencies we see in older adults? And B12 is definitely one of the most common nutritional deficiencies. They estimate about a third of adults over the age of 50 may be low in B12 and may require supplementation in addition to a B12-rich diet. So what are some of the risk factors for having a low B12 level? There's many. One can be related to the eating style. If someone is moving towards a vegetarian or vegan style of eating where there's fewer animal products in the diet, you can end up seeing a B12 deficiency because only animal products provide B12 sources, as well as medications such as some of the acid suppressing medications. Metformin, a common medication we use in diabetes and diabetes prevention, can impact on B12, as well as changes as we age in the absorption in terms of the intrinsic factor protein in the stomach that's needed to absorb B12. Acid changes may affect how well that intrinsic factor is working. Other GI conditions, as we mentioned, heartburn, acidity, celiac disease, as well as any gastric surgery. So if someone's had a hernia surgery or bariatric surgery, all of those are important considerations to assess someone's B12 level. Vitamin D. So this is another very, very common deficiency we see in Canada, partly because between September and May, the exposure to the sun, where we are in relation to the sun, we may not have as much exposure and production of vitamin D in our skin. And for that reason, we do need to supplement vitamin D. At least 1,000 international units a day of vitamin D3. Now, your family doctor may advise more if there's other health conditions as well, but at least 1,000 international units a day. And as we can see from this slide, vitamin D is very limited in our food supply. It's really only in fish and milk. We add it to milk, it's fortified, and shiitake mushroom. So very few foods have a good source of vitamin D. And low levels of vitamin D are associated with poor health outcomes, things like falls risk, depression, as well as impact on immune function. Magnesium. Magnesium is a very important mineral for many functions in the body. It's essential for sleep, our bone health, our heart health, many enzymes it's involved in. So a deficiency in magnesium has an impact on multiple health systems. And deficiency in magnesium is much more common than we had thought, and this is related to changes in things like dietary intake. If there's more reliance on processed foods and less whole grain foods, there tends to be lower intake of magnesium. As you can see here, magnesium's in things like pumpkin seeds, which is a great source, other nuts and seeds, quinoa, leafy greens, things like banana, peanut butter. But if your patient is not consuming those foods, it's quite easy for them to go low in magnesium. And in addition, there's medication interactions. So many of our water pills, for example, can interact with magnesium levels as well. So what can you do as a healthcare provider? You have a very important role because your role is to know the signs of malnutrition, watch for those seniors who may be at nutritional risk, screen for things like unintentional weight loss or low appetite, watch for nutritional deficiencies, chart those risk factors in the patient chart, refer the patient to an appropriate care provider, whether that's a dietitian on your team or a nurse or other family or a family health team, for example. And the other key role you have is education, educating your patients and their families on how to correct and prevent malnutrition. And then, of course, it's important to evaluate our efforts. Are we seeing an improvement? And then, of course, N stands for networking, connecting our senior to other supports in their community. So I've included 2 screening tools here for you that you may want to consider using at your sites. One is called the Canadian Nutrition Screening Tool. It's the one on the left. It has 2 questions that asks about unintentional weight loss and low appetite. And another tool called Screen 3 is on the right. It's an 8-item question, and again, the first 3 questions have to do with things like unintentional weight loss, low appetite, as well as dysphagia, difficulty chewing or they're coughing excessively, so difficulty swallowing safely. And the other 5 questions start to explore things like food preparation and food intake and access. Both of these are very good tools to identify seniors who may be at nutritional risk and require further assessment. So now let's switch gears from some of the nutrition concerns to nutrition basics. What can we recommend to our patients of what to eat, when to eat, how much to eat, and what are some meal planning suggestions for you? So this is a question we get often from our patients. How do I know or how do I make sure I'm eating well? Well, healthy eating is about not just getting those foods that your body and your brain need to be nourished, but also about enjoying your foods as well. So we don't want people to be depriving themselves or thinking that they have to eat in a perfect way. Think about healthy eating is for health, but also for enjoyment. And the good news is there's many healthy ways to eat. There's a lot of literature out there that shows many different eating patterns are linked with improved health outcomes, with longer lifespan or longevity. Some of the eating patterns you might have heard about are the Mediterranean diet, the DASH diet, which stands for Dietary Approaches to Stop Hypertension, Blue Zones, Japanese, Nordic. There's many healthy eating patterns. And so when we look at these eating patterns, what do they have in common? Well, they all tend to be quite rich in very cardioprotective foods, things like fruits daily and vegetables. They have nuts and seeds and beans, legumes, having peas, beans, and lentils. They have a variety of whole grains, as well as fish and olive oil, some good fats, as well as calcium-rich sources like milk, yogurt, and cheese. What these eating plans don't have a lot of is ultra-processed foods. So all of these healthy eating styles are very rich in nutrient-dense foods, but they don't have a lot of fast foods or sugary foods. And that's a good thing because as we see from the literature, a high intake of ultra-processed foods may actually have a structural effect on the brain in the area of the hippocampus, which is the area involved with learning, memory, and our mental health. So here's 2 examples of some of the healthy eating patterns you might have heard about that have good literature to support helping your clients adopt some of the aspects of these styles. There's the Mediterranean diet on the left, which is quite rich in fruits and vegetables and whole grains and olive oils, good fats, nuts and seeds every day, with fish 2 or 3 times a week, and poultry and eggs and cheese and yogurt also several times a week, as well, and you'll notice at the very top, meats and sweets are less often, still included, but less often. On the right, there's the MIND diet. So the MIND diet is an exciting new eating plan that really is a combination of the Mediterranean style as well as the DASH style, which is the dietary approaches to stop hypertension or high blood pressure. And the MIND diet has been linked with reduced rates of neurodegenerative delay or prevention of dementia. And they're very similar, as you can see. Again, there's things like fish 2 or 3 times a week, or in the MIND diet at least once. They really do advocate for a variety of colorful fruits and vegetables, as well as nuts and seeds, as well as good quality whole grains that provide fiber. So thinking about those aspects of those healthy eating patterns that are based on whole foods, if you had to compare these meals to decide which of these meals is the closest to sort of the Medi or MIND style of eating, is it breakfast number 1 with the waffle and eggs and bacon? Is it breakfast number 2 with the peanut butter on whole grain toast with banana and cantaloupe and a cup of coffee? Or is it breakfast number 3 with a whole grain flakes with a glass of juice and a coffee and toast with jam? So if you've guessed breakfast number 2, then you're correct. That is the breakfast that is the most whole foods in terms of lots of fruits there, whole grain breads, a good fat from the peanut butter, and some protein there as well. The other 2 breakfasts, number 1, for example, is much higher in saturated fat, not a lot of fiber, in fact, hardly any fiber at all in breakfast number 1. Breakfast number 3 does have some whole grain cereal, but very low in fiber because of the juice and the jam, which doesn't really provide much fiber at all. So Canada's Food Guide, every year not every year, but every few years, we update our Canada's Food Guide, and it's based on the existing evidence or research we have. And so the 2019 Canada's Food Guide was created based on the evidence from things like the Medi diet and the DASH and the Mind diet and the Japanese and all those healthy eating patterns I mentioned, because those are linked with promoting health and preventing some of the chronic diseases we see like diabetes and heart health. So let's take a closer look at this Canada's Food Guide. Well, as a diabetes educator, we're quite excited to see this plate model because this makes a lot more sense to patients when they're thinking about how to plan a meal. You can see that with this plate, we're trying to aim for half of the plate from vegetables and fruits. Now again, you wouldn't need this many different choices at one meal, but they're just trying to show you the different examples of fruits and vegetables you might consider having there. On the right side of the plate, a quarter of the plate, we want it to choose whole grains or to have whole grain choices. So again, high fiber grains that will give us energy and fuel for our body and our brain. And you can see some choices there like whole grain pasta, whole wheat bread, you've got quinoa, etc., and rice. And the remaining quarter of the plate is protein foods. And here they've also included things like from the dairy foods. So you can see the little dish of yogurt there. There's eggs, there's salmon, there's beans, etc. So again, they're showing the different variety of proteins you could consume, but with this idea of making a quarter of your plate protein. So let's talk a bit more about each of those food groups. So vegetables and fruits. So we know these are wonderful sources of antioxidants, vitamins, and minerals, as well as fiber. And again, a high intake of fruits and vegetables is linked with lower rates of diabetes, heart disease, and certain cancers. And a very important recommendation for our patients is to try to help encourage the addition of vegetables, fruits in their daily intake. Again, another idea to share with them is try to think a rainbow of color. Different vegetables and fruits do have different antioxidants, so you're trying to shoot for orange and green and purple, a nice variety of different types of antioxidants there, and a nice pleasurable way to look at the plate when you see a variety of colors. Whole grains. Now, grains and starches are a rich source of carbohydrates, and carbohydrates are foods that energize. They break down into glucose and provide your brain and muscles with fuel. So very important to have carbohydrate foods at each of our meals. What we want to be mindful of is, again, planning our plate so that only a quarter of the meal is the carbohydrate. And again, we want to try to pick carbohydrates like grains like rice and pasta and bread and cereals that have more fiber in them, so they include the whole grain. And when it comes to whole grain, what we mean by that is the outer shell of the grain, which contains a lot of fiber, as I mentioned, as well as the B vitamins and things like magnesium. So food products like breads that are whole grain will give generally more fiber and nutrients than a bread that may have that outer shell removed and therefore less nutrients there and usually a lot less fiber. And that is one of your ways to identify that is by looking at the label for the grams of fiber. So when we look at a label, to give you some suggestions here, one of the first things we always look at is the serving size. So you can see on this label, it's for 1 cup of this food product. And then when we're looking for fiber, you look down under the word carbohydrates and you're trying to see how many grams of fiber does this food have. So this 1 cup of food has 2 grams of fiber. So that would be considered a source. So it has a bit of fiber. But ideally, if we can pick foods that have 4 grams of fiber, which would be considered a high source, 4 or more, or 6 grams or more of fiber, that's considered a very high source of fiber. So how many grams of fiber do we need each day? Well, that will vary from person to person, but on average, it's about 21 to 38 grams of fiber each day, and that's very important for many different reasons. Fiber has benefits not only on our gut health, which many of us already know. Fiber is also a prebiotic, so it feeds the healthy probiotic or bacteria in our intestine, so it helps build a healthy gut microbiome, but it also helps benefit things like blood sugar as well as lowering cholesterol. The type of fiber in particular that is very good for lowering sugar and cholesterol is soluble fiber. And soluble fiber comes in fruits and vegetables, particularly the ones where you can eat edible skins, as well as products like psyllium. And we've put 2 food products here. One is Kellogg's All Brand Buds that's been fortified with psyllium, and the other one is Metamucil, which is psyllium powder. Again, both very good sources of psyllium, which is another soluble fiber that gives us multiple health benefits. So let's talk about carbohydrates. There's always a bit of confusion about carbohydrates, but carbohydrates come from a variety of different foods that we consume. One is fruit. Fruit gives us fructose, which breaks down to glucose and gives our brain and muscles energy. Another food category that gives us natural sugars is milk and yogurt. They give us lactose, and lactose also breaks down to glucose to give us energy. And then the third category, which is probably the one that more people think about when they think about carbohydrates, are things like the whole grain foods like bread, rice, pasta. Again, we've put potato here as a carbohydrate. Potato tends to be a starchier vegetable. So in, say, the diabetic style of eating, we tend to count potato as a carbohydrate, as 2 bread choices or 2 carb choices. All of these foods very important for us. So again, by the end of the day, we want to try to have at least 2 or 3 fruits a day, as well as milk and yogurt for calcium sources, at least 2 or 3 a day. And again, whole grains at each of our meals is a great way to provide the body with that energy that it needs, but also the important vitamins and minerals that you get in these other foods as well. So should I avoid carbs? This is a question we commonly get as dietitians. But as I mentioned, going without any carbohydrates can really impact your mood and also your gut health. So many people may notice they get crankier or they're not themselves. Some people notice the GI symptoms like constipation starts to affect them. So again, carbohydrates provide energy. So if there's not enough energy at our meals, it can really affect our concentration and mood. It can also lead to low blood sugars, particularly for our patients who have diabetes. We really need to be mindful of evening out carbohydrates throughout the day and not having meals that avoid any carbohydrates. And as I mentioned previously, carbohydrates come with many different vitamins and minerals. Grains, for example, like breads and cereals, also provide iron and magnesium. And when people are cutting out those carbohydrates, we can start to see deficiencies develop in some of those minerals. Now, when it comes to carbohydrates, what are some of the carbohydrates I should reduce? Well, we want you to have fruit and milk and yogurt and good quality whole grains, but the types of sugars we want you to reduce are the added sugars. So these are the sugars that you add into your foods, like sugar in your tea or coffee, or these are the sugars added to foods during processing, such as making a yogurt where extra sugar is added, or making an oat milk, for example, where extra sugar is added. So this is the area we want to try to help people reduce, because as you can see, on average, Canadians, we get about 26 teaspoons a day of added sugar. But current guidelines from Health Canada are only recommending somewhere between 6 and 9 or 10 teaspoons of added sugar a day. So this is definitely a place that we want to reduce our intake. So what's the best way to reduce added sugars? One of the first ways is to start to look at the beverages you're drinking. Start to look at things like your coffee, any juices or pops that you're having. These can come with quite a bit of added sugar. So you can see here this glass of water with lemon has 0 grams or 0 teaspoons of added sugar, but the energy drinks and the coffee and the pop here you can't quite see, but that's up to 10 teaspoons of added sugar in one pop. And that's quite significant. So we want to try to reduce the sweet drinks we're having, but at the same time, we want to make sure we're getting enough fluid, because we don't want people feeling dehydrated, because dehydration can affect mood, it can affect kidney function, blood pressure control. So we do want fluid. So we encourage you to make water your beverage of choice. Aim for at least 9-10 cups of fluid. Some people will need more each day. Coffee and tea still count as fluid, but again, we're trying to be watchful of the amount of caffeine, particularly if someone is quite sensitive to caffeine and having issues with sleep or issues with rapid heart rate. We do tend to minimize caffeine. Another way to look for added sugars or extra sugars is to look at your label. So when you go to a nutrition facts label, again, down in the carbohydrate section, there'll be sugars in grams. And one way to help you interpret that number is to look at the percent daily value, the little percentage. And if it's less than 5%, that indicates it's just a little bit in this product. But if it's greater than 15%, that indicates that there's quite a bit in this product. So you can see this sugar is 22%, which is well over the 15%, indicating there's quite a bit. In addition, you can go to the ingredient list and look at what is listed in the first few ingredients, as this is listed by weight in the product. So you can see sugars in the examples here, molasses, different sugars they've added to this product. It's the first ingredient, so it's quite prevalent in this food product, and this would be one of those foods to be very mindful of how often you might have. Okay, so let's switch to other nutrients we want to make sure older adults are consuming enough of, and that's protein. So protein foods are the compounds in our foods, our amino acids that build chains of proteins that help us build and repair muscles. Proteins are needed for making enzymes in the body. They're important foods because they also bring with them many other vitamins and minerals. So for example, a piece of chicken or fish, you're getting, as we mentioned, fish, you're getting vitamin D, you're getting iron, you're getting protein, zinc, for example. So a very important source of many minerals and vitamins, as well as building blocks for our muscles. Now, how much protein do we need a day? Well, that does depend on the person, but this is a good estimate of 20 to 25 grams of protein per meal is a good starting point. With seniors, in fact, we do recommend at least 1 gram per kilogram of body weight. If a senior is malnourished, we go higher. So that's usually 1.5 to 2 grams of protein per kilogram body weight. Again, that's something you would want to work with the dietitian on your team to help ensure that that amount is appropriate for your patient. So when it comes to protein in Canada's Food Guide, we're trying to promote variety because each protein choice is slightly different. Even though we classify it in the same group, it does provide slightly different amounts of vitamins and minerals. And so we want that variety that is both animal sources, if you like animal foods, fish, chicken, lean beef, for example, but also some plant proteins because plant proteins are generally higher fiber. Animal proteins don't have any fiber. So if you're picking beans, for example, swapping in a meatless Monday meal with beans instead of chicken, you're now also adding more fiber. And we've already talked about the benefits of fiber. So variety of protein is key. So when you think of your week, try to vary the choices you're picking. Perhaps maybe chicken 1 or 2 days, fish 1 or 2 days, maybe a meatless meal 1 or 2 days. So again, to vary those choices. Now, fish, as we mentioned, is an excellent source of protein, but certain fish are also an excellent source of heart-healthy fats called omega-3 fats. So fats like EPA and DHA are the short forms, and they stand for words like epipentanoic acid and dexahexanoic acid. And those type of omega-3 fats are highly linked with improved heart health, less inflammation. Many of our psychiatrists may use it for depression with some of our patients as well. So linked with many important functions in the body. So we want to encourage you, and as well as you to encourage your patients to enjoy fish often in their week if possible. Try to aim for fish at least 2 or 3 times a week. And again, the fish that are specifically high in omega-3 are fish like salmon, mackerel, herring, sardines, and trout. Now, if you're not a fish lover or you're moving towards more of a vegetarian style of eating, there are omega-3 fats in non-animal products such as walnuts and flax seeds and chia seeds. This is ALA, a different type of omega-3 that you can get in plant sources, as well as when they feed flax seeds to the hens. Hens lay omega-3 rich eggs, which again do give you some omega-3. So heart health. So we want to focus on the heart healthy fats. Years ago, recommendations were around low fat, which is not what we advise at all anymore. And so we want to encourage people to choose those fats that are very rich in what we call unsaturated fatty acids, monounsaturated fatty acids, for example, or polyunsaturated fatty acids. And the foods that contain that are things like our oils, our olive oil, canola oil, the nuts and seeds that we enjoy, and nut butters like peanut butter or almond butter, as well as we just mentioned, fish, for example, has those omega-3 fats. Avocado, for example, has what we call monounsaturated fats. So all of these fats are very important because they're essential nutrients, but they also provide energy, and they also provide, as we mentioned, these special fats to help our heart health, but they also help with absorbing fat-soluble vitamins, vitamins like vitamin A and D and E and K. And of course, most importantly of all, they provide delicious taste and texture to our foods. The fats we want less of are what we call saturated or trans fats. So these are often visible fats you can see on food, for example, skin on a chicken, for example. You also want to be mindful of how your foods are processed. So when they're deep fried, the oil can change when it's heated at high temperatures and repeatedly used, and that can actually increase the intake of trans fats, which impact on things like your cholesterol. We also want to be watchful of hydrogenated foods, foods like shortening and lard, for example, Some of our processed meats can have quite a bit of saturated fats, as well as our commercial baked goods. Things like our donuts and our pastries can be quite rich in saturated fats. Of course, there's always ways to modify those recipes, but be watchful of some of the commercial baked goods that could be high in saturated fat, particularly if you're trying to lower your cholesterol or improve your heart health. So when it comes to eating, how much is the right amount to eat? And that's where it's different for each person. But one way to start to estimate portions is by using either the Canada's Food Guide, as we mentioned, trying to do half your plate vegetable, a quarter of your plate protein, and the remaining quarter of your plate starch. Another way to estimate portions is based on your hand size. So because we're all different body sizes, our hands are a good way to estimate portions as a starting point. So for example, when you're thinking about starch, you want to try to make it the size of your fist. Or if you're thinking about a fruit choice like an apple or a pear, make it the size of your fist. When you're thinking about protein, you want to think about the size of your palm and about the thickness of your palm. When you're thinking about vegetables, we try to say 2 handfuls of vegetables. And when we think about good fats, we say the size of your thumb is a good estimate. So we've talked about what to eat and we've talked about how much to eat. So now let's talk about when you eat. Using the rule of threes is a great tip to remember to aim for 3 meals each day. Try to space those meals apart by every 3 to 4 hours. And you want to make sure when you're having a meal that you're consuming 3 different food groups or food categories at each meal. But it's not just about what you eat or when or how much to eat. It's also about how you eat. We want to make sure you're enjoying your food, that you're taking time to eat, chewing safely, sitting up straight and chewing well, taking time to pay attention to the food so you can really enjoy it. Eating without distractions is another really important suggestion because appetite can really be impacted if there's a lot of distractions around someone. So trying to turn off our phones and turn off our TVs can be a very helpful tip to helping particularly older adults and children as well as all of us focus more on our food. Making time to eat, for many of the seniors I work with in the community, they're often very project oriented and they want to finish the project before they stop to eat. But it's very important to remember that every 3 to 4 hours your brain needs fuel. So you do want to stop and take a break and have a snack or a meal. And then lastly, it's important to include foods that are important in your culture and foods that you enjoy and foods that have special meaning for you. Cooking and eating together is also an important activity for seniors and families. We want to look for opportunities for our seniors to really stay connected with others, and eating together with others and cooking and preparing meals is one way to do that. In the city of Hamilton, we have many community kitchens and community gardens, so independent seniors could become involved in that where they can cook together with others and take some of the food home as well. And again, it's a chance to connect. So let's switch to some meal planning ideas for you. So we've talked about a summary of nutrition, and by the end of the day, one of the things that you might want to do to sort of see how close am I to what is recommended that I should be eating, and you can ask yourself this question, by the end of the day, did I have, and again, this is where you use the number three, did I have 3 or more fruits today? Did I have 3 or more vegetables? Did I have protein at each meal? Did I have a whole grain choice at each meal? Did I have 3 calcium-rich foods? Did I have healthy fats, 3 servings of healthy fats? And did I have at least 3 or more cups of water? Again, none of us eat perfectly every day, but this is a good way to do a check-in at the end of the day. And if you're deciding on whether or not to have a snack, you might pick a snack based on a category you might not have had enough of that day. So perhaps you didn't have enough calcium, so you might decide to have a yogurt or a glass of milk before bed. So let's do an activity together where we can practice preparing balanced meals. So when you think about balanced meals, well, let's get you to take a minute and write down a sample meal. Perhaps it was a meal you had yesterday or a meal you had today. It could be a lunch, it could be a dinner. Just take a minute and jot down what you had at a meal, and we'll just use that as an activity example. So one of the first questions you want to ask whenever you've looked back at a meal, you want to first assess to see, does it match the Canada's Food Guide or the balanced food plate idea? So does it have half of the plate vegetables? Was there protein on the plate, and how much was that? Was it a quarter of the plate? Was there whole grain like pasta or rice or bread or quinoa on the plate as well? And how much was that? Was that close to a quarter or more? When it comes to the whole grain, we also want to think fiber, as we mentioned, right? We want to try to pick whole grains that have more fiber and B vitamins. You know, looking at the label, if you have a label on your bread, for example, does it have more than 4 grams of fiber per serving? Another question to ask when you look at a meal is, does it include a food source of calcium? Was there milk or yogurt, cheese, or perhaps there was a non-dairy choice like tofu or almonds? And lastly, did it include a healthy fat? Again, we know fats are so important for our heart health and our brain health, but also really help with meal satisfaction. So you want to make sure you've got a healthy type of fat on there. Did you have olive oil or canola oil? Did you have a few walnuts sprinkled in there or avocado? So again, that's a nice summary of some of the key nutrient considerations to look at when you're looking at a balanced meal. So to summarize, what are some of the top 10 healthy eating tips for healthy aging? One is eating regularly throughout the day, eat with others whenever possible, try to cook at home if you can, and be sure to include foods from your culture and foods that provide nourishment and enjoyment. You can use the plate method to decide on how to do a balanced meal, or you can use the hand jive or hand portions to estimate the portions that may be right for you. Try to include protein at every meal. Try to have calcium-rich food at each meal. Of course, remember your vitamin D supplementation, and then if you have any nutrition concerns, discuss those with your doctor or dietitian, and they can look at your individual needs. I've included some tools here for you and websites that you may find valuable. Lots of great information. Unlockfood.ca is from Dietitians of Canada with some wonderful resources on senior nutrition, and I've included one to the right side here, a guide to healthy eating for older adults. Of course, dietitians.ca is the overall Dietitians of Canada site with so many different subjects and topic areas in that website. The Dietitians of Canada also has a wonderful app called cookspiration.com, which has some terrific recipes for snacks and meals that are quick and easy to prepare. So many recipes there you might enjoy. And we've also done other webinars on healthy eating for seniors at the Hamilton Family Health Team. So we have a YouTube channel, and I've included the link here to our other presentations on healthy eating for seniors. So now it's time for questions. So welcome back everyone to Nutrition for Healthy Aging. This is session 2. I'm Michelle McDonald-Werstack, a dietitian and a nutrition groups coordinator here at the Hamilton Family Health Team. So to recap session 1, we've talked about why healthy eating matters for seniors. We went through some of the nutrition basics for planning healthy meals and snacks, and we've introduced you to some of the screening tools that you may want to use at your settings to identify seniors who may need extra supports. In session 2, we want to do a deeper dive into some of the common health conditions that many of the seniors you're working with may be living with, and some of the nutrition information and advice that you can offer around diabetes, dementia, and palliative care nutrition. So first, let's talk about what's happening in diabetes. So in diabetes, there's changes happening at multiple sites in the body. Changes are happening in the pancreas, which is the organ that produces insulin, and insulin is being released, but not as effective as it used to be. At the muscles, brains, and organs, there's resistance to taking in the insulin and the sugar, and so as a result of that, blood sugars start to increase. And thirdly, in diabetes, the liver is starting to leak out sugar when there's already enough sugar in the bloodstream. So our liver is partly responsible for pulling in sugars and producing glycogen and storing that for us. And during times when we're sleeping or in between our meals, for example, our liver would release some of that stored sugar back into the bloodstream as needed. But unfortunately in diabetes, it's starting to miscalculate. It's starting to release too much when there's already sugar out there, and then sometimes not releasing enough, and people are having low blood sugars. So what are some of the signs of high blood sugars? Well, many patients may report feeling tired or thirsty, also craving sweet foods because their energy is low. They may also notice that wounds or infections take much longer to heal than usual, and they may report excessive urination. What are some of the blood tests that we want to order every 3 months? The main test that we order is called A1C, hemoglobin A1C. We're aiming to keep that less than 6.5% if we can safely do so. But again, that target may be adjusted based on the healthcare needs of that individual. But this is an important test that we order every 3 months that basically measures the amount of sugar that sticks on to red blood cells, and it gives a weighted measure. What are the ideal glucose targets we want to be looking for before we eat a meal? Well, when you're testing sugars, you want the sugar to be between 4 and 7 millimoles per liter before you would eat a meal. So this would be before breakfast or before lunch, before dinner. But what about after eating? What happens 2 hours after a meal? Now, 2 hours after a meal, the sugar you've eaten at the meal will have absorbed into the bloodstream, so it will go up a little bit. And that's where we use the target of between 5 and 10 millimoles per liter as a good target range to shoot towards. When it comes to healthy eating for diabetes, as we mentioned, the rule of threes is a great reminder for healthy eating for everyone, including someone with diabetes. So aim for 3 regular balanced meals each day. Try to eat every 3 to 4 hours, which may require a snack in mid-afternoon or a bedtime snack as well. And aim for at least 3 food categories at each meal to get a nice diversity of different nutrients. So what can happen if you skip meals? I have many seniors who will say, well, I don't feel like eating lunch, or I was busy and I didn't stop for lunch. Well, these are some of the symptoms that can happen if you're not eating on a regular schedule. You can start to see a drop in the blood sugar, and that may bring on things like a rapid heart rate. You may get shaky, sweaty. You might feel a bit headachy, maybe anxious. That can bring on anxiety as well. And the worry here is low blood sugar can also increase the risk of falls in our senior population. So low blood sugar is defined as glucose less than 4 millimoles per liter, but could be, for some people, they may start to have these symptoms even when their sugars are in the 5 range. So what do you do if you have a low blood sugar? The first important thing is to stop what you're doing and to get some fast absorbing carbohydrates into you. So 15 grams of fast absorbing carbohydrate. This could be 3/4 of a cup of juice. This could be 4 to 6 candies. There's also glucose tabs you can buy at your pharmacy, and you would take 3 to 6 of those depending on the brand that you have. So again, these are fast carbohydrates. These are to raise the blood sugar quickly, up at least a couple points into the normal range. We want you to rest for 10 or 15 minutes and then to check the blood sugar again to make sure it's gone up. If your next meal is more than an hour away, you're going to have a snack to tide you over to help maintain blood sugars until that meal. And that can be something small like half a cup of milk and 2 plain arrowroot cookies. It could be, 6 crackers and a piece of cheese. So again, something small to carry you towards the next meal. But the most important thing, once you've treated the low, is to figure out, why did I go low? Did I go low because I went too long without eating? Was I more active than normal, more exercising, cutting the grass, etc.? Or do I have too much medication? And I need to have a discussion with my team about reducing my medication. So going too long without eating is very hard on the blood sugar, because we want to try to aim to keep blood sugar as smoothly as possible. So we want to avoid the big spikes and drops that you see here with this yellow curve. We want more of that smoother yellow curve where sugar just goes up. It starts at 5 or 6, and then it goes up to 7 or 8, maybe 9, and then back down to 5 or 6 before the next meal. So a nice smooth curve to our blood sugar. And it's important that we have those regular meals, because we want to try to give the body and the brain glucose so we feel our best, and we want to prevent low blood sugars. So this is more important as we age. The risk of low blood sugars may increase with aging. And it's really important also to remember that food is important for mood regulation. So we really want to stabilize our mood and also prevent overeating later in the day. So for some people, they may go long stretches in the day with very little food and then notice they're eating the majority of their food later on in the evening. So as I mentioned, diet is very important for our mental health. Protein and carbohydrate foods work together to actually create serotonin, which is the neurotransmitter in our brain, which does help with mood regulation and feelings of joy. And if we go with too little carbohydrates, it really can start to affect our mood, our bowels, and it makes it harder to think and work and exercise. So here's a question for you. Avoiding foods with carbohydrates like bread, rice, pasta, and potatoes is the best way to control diabetes. Is that a myth or is that a truth? Well, for those of you who guessed it's a myth, you are correct. As we mentioned before, carbohydrates are energy. They provide us with glucose, which is what our brain and muscles and organs prefer as a source of energy. As well, as we mentioned before, they also give us many other important vitamins and minerals like iron and magnesium and B vitamins. So when it comes to whole grains and carbohydrates, we don't want to avoid them. We want to balance our intake throughout the day, and we want to pick the type of carbohydrates that absorb slowly and don't raise the blood sugar too much. And this is a tool I want to introduce you to called the glycemic index. This is a traffic light analogy with green light, yellow light, and red light foods. And what it does is it compares these foods in the different categories with how much they raise the blood sugar compared to a slice of white bread. So for example, if we look at the breads across the top, you'll notice in the green column we have sourdough, in the yellow column we have rye bread, and in the red column we have white bread. So the bread in the green column, like sourdough, will tend to give us a better sugar, less of a rise after the sugar, more smooth rise than say a bread in the yellow or red column. So again, this glycemic index helps rank these foods for you, and you can use this tool to help with your own food choices or with the food choices you're helping with your seniors in your setting. So when it comes to cereals, you can do the same thing. You can compare across the page which cereals will give you a better blood sugar effect and raise the sugar less would be in the green column. Same with rice and same with potato. You might be surprised to see sweet potato actually at the bottom of the green column under the other section, actually giving a very good blood sugar effect. So using this idea of glycemic index, which of these two lunch meals is most likely to give you better blood sugars? Is it the lunch on the left with the white bread, juice and fruit? Is it the sandwich on the right with the whole grain bread and a glass of milk? Well, if you guessed the sandwich on the right, using the glycemic index, you are correct. This will tend to give you better blood sugars 2 hours after you eat that meal. So let's talk more about myths and truth, because there's a lot of information out there around diabetes, and some of it may be true and some of it may not be true. So what do we say when it comes to fruit? Eating 3 fruits, a cup and a half of fruit each day, is part of a healthy eating pattern for everyone. And in fact, that's truth. Fruits can give us a variety of different vitamins and minerals, fibers, things like potassium, magnesium, a very good source of energy as well. So they do give us fructose, but they give us many other vitamins and minerals that are very important for our heart health, particularly our blood pressure control. Now, what about cakes and desserts and ice cream? These are foods we all enjoy. And do we need to give them up completely if someone has diabetes? And that's a myth. We don't need to give them up completely. It's all about balance and moderation, enjoying these foods once in a while. We do want to be mindful of added sugars, though, because that is one area we want to reduce, as we mentioned in session 1, but we still want to have that enjoyment of having these special foods once in a while. So what about alcohol? Can alcohol affect your sugars? Can it make your sugars go up or down? And in fact, it can. It can actually do both. Drinks that are made with alcohol can have added sugars, so that can raise blood sugar, but alcohol itself inhibits the liver's release of stored sugar, so you can sometimes get a low blood sugar hours later after consuming alcohol. So it's really important if you are consuming alcohol to consume that with food, so it's less likely of a chance of having a low later on. And again, this may be something to speak to your family doctor to discuss your own individual needs when it comes to alcohol. How much to have at a meal? This again is one of the most important strategies, is to portion our plate. So using the plate planner is a great way to section your plate. As they show here, half the plate vegetables or with a bit of fruit on that side, and the other half of the plate is divided between the whole grain foods, the bread, rice, pasta, quinoa, etc., and the protein choices. Again, trying to have plant proteins in there at least a few times a week if you can. So the plate planner is a great way to think about lunches and dinners. Do I have those foods at my meal? Or you could use the hand estimator. That's another way to estimate portions. As we discussed in session 1, the size of your fist would be the portion of grain, that would be, say, your portion of baked potato, and the size of the fist is also your portion of fruit, and your open palm would be the portion of protein. Here they have a piece of chicken there. as well as your vegetables will be 2 hands full. So again, quite a bit of vegetable. And the thumb would be your healthy fat, like your olive oil that you might drizzle on that meal, or the spoonful of margarine you might be using on your potato, for example. So those are 2 ways to estimate the portions you may need. So another thing we can help our patients with is really helping prepare them for their healthcare visits. And so when someone has diabetes, we do want to meet with them every 3 months in the family doctor's office to review their blood work, to see how they're managing with their dietary intake and activity, to review their medications and make sure they're not having any issues with their medications. So encourage your patients to connect with their family health team or their family physician office every 3 months and be prepared for those visits, whether they're in the office or on the phone, to try to complete their lab work 1 week before the scheduled visit, have a 2-day food and glucose record ready. For many of our patients, we ask them to jot down what they're eating and drinking for a couple of days, and if they're testing any sugars, to put that on the form as well. And then, of course, if they're testing home blood pressure readings, we like to see those trends, as well as any updated medication lists and the supplements that they're taking as well. So let's look at a case example of a patient. This is Anna, and she's 78 years old. She has diabetes. She's on multiple medications, 2 of which are for diabetes, metformin and Jardiance, and then she's on Crestor for cholesterol lowering and Conversal for her blood pressure. Her recent blood work shows her A1C, her average blood sugar is 8.2%, so a bit higher than the 6.5% or 7% we shoot for, and her B12 is also low at 150, and ideally we would like that to be between 300 and 600. She's also reporting some weight loss of 10 kilos over the past couple years, which is quite significant. She's reporting fatigue and lower appetite, memory changes, as well as dry mouth and increased thirst. When we ask her about her intake, it's quite sparse earlier in the day, with only toast and coffee, and then often skipping lunch, but she does try to have a balanced dinner most nights, but with that dinner she has 2 or 3 drinks of alcohol. Currently, she's not taking any supplements, and she is finding it's challenging with a limited budget for food, and she does feel some social isolation since her husband passed away. So what are some of the concerns that we see in terms of nutrition-related concerns with Anna? Things like medication side effects that could be impacting on some of her energy and blood work. Things like metformin and Jardiance are very good at helping with the glycemic control, but can affect B12, may also suppress appetite a little bit. The unintentional weight loss is a red flag here. She's lost 10 kilos over the past couple years, which is quite significant. Risk of dehydration with increased thirst and dry mouth, and really inadequate intake. When we start to look at her day, she's not meeting the increased nutrient needs that she needs, particularly as we've discussed things like protein and calcium, etc. And then the alcohol intake each day does have an impact on nutrient absorption, and someone who has daily alcohol may actually have increased nutrient needs. As well, she's not supplementing with vitamin D, which we know is a falls risk. So what can we do for Anna? So some of the things we can do as healthcare providers is look for those signs of possible nutritional risk or risk of malnutrition, things like unintentional weight loss or low appetite. We can use the screening tools I mentioned in session 1, Screen 3 or CNST. We want to focus on regular meals every 3 to 4 hours and a couple of snacks in the day as well if there's longer gaps between meals. Using the balanced plate to plan meals so that Anna is getting a variety of different nutrients. Ensuring meals have multiple different food groups at each meal. Recommending a high protein supplement is sometimes something we do, such as a Boost or Ensure High Protein. There's multiple supplements on the market now, and we often advise a third of one of those after each meal to supplement the diet. Of course, we want to recommend vitamin D3 supplementation. We also want to take a closer look at her fluid intake. Is she consuming enough fluid throughout the day, and is she getting some water? And then when it comes to the food insecurity piece, what can we link Anna to help stretch her food dollars? Is it education that she'd like? Would she like to link to a local food bank or neighbor to neighbor where they may have a community garden or community kitchen where she could cook or grow vegetables with others and get the social connection as well as access to foods? And of course, you can always refer her to a registered dietitian as part of the family health team, or if she's with another physician office, you can see if she has a dietitian there where they could do an individual assessment to dive deeper into what are some of the nutritional concerns and strategies we can use for Anna. So let's switch gears and talk about dementia and nutrition. So when a patient is experiencing cognitive decline, there are many signs that may be early warning signs that you as a healthcare provider may notice. You may start to see less interest in eating. You may notice medications are impairing the appetite, or constipation really is suppressing appetite. You may notice your seniors having a difficult time making decisions over what to eat or what to buy or what to make. They might not even enjoy cooking anymore and may find that too challenging and start to rely more on processed foods. That can start to lead to a real limitation in the variety of food. As cognitive decline worsens, you may start to see your seniors not recognizing foods that they commonly would consume. You may find there's feeding difficulties, difficulty for them to chew safely without choking, so some dysphagia. And of course, this can all lead to weight loss, unintentional weight loss that can lead to malnutrition, which can further the risk of falls and hospitalization. So again, a lot of nutrition challenges in mild cognitive impairment that progresses to dementia, from deficiencies to malnutrition, malabsorption. They may have increased nutrient needs as well with aging. So many different challenges that our patients are facing. So when it comes to prevention and management of dementia, I was reviewing the Lancet Commission in terms of their recommendations of where can we focus on modifiable risk factors for dementia prevention. And many of these areas are areas that we can make a significant impact as healthcare providers in terms of helping to promote optimal nutrition and hydration, promoting weight maintenance so our seniors are not losing weight without intentional efforts, reduce excess alcohol intake. We want to promote healthy eating to manage the hypertension and diabetes. You can see are the top two here, as well as depression, because there's quite a bit of literature showing that healthy eating patterns may help prevent depression. As well, promoting activity, helping our seniors stay mobile, encouraging less smoking or smoking cessation, and reducing excessive alcohol intake. And of course, linking them with social supports as well for social connection. There are all things that we can do. In terms of helping to improve blood pressure and sugars, again, we want to aim for blood pressure less than 130/80 and an A1C less than 6.5% if we can. So how can we do that? What are some of the nutrition suggestions? When it comes to improving blood pressure, tracking blood pressure or monitoring is one of the best things we can do to look at trends, to see are we seeing changes, are medications working appropriately? We want to focus on regular balanced meals, of course, reducing added salts because sodium can be harder for the kidney to manage as we age. We want to also ensure other important minerals are a part of our diet, and that includes enough calcium, magnesium, and potassium in particular may be very important and part of this DASH diet, dietary approaches to stop hypertension, that is so effective at improving blood pressure. When it comes to nutrition tips to improve blood sugar and manage diabetes, again, monitoring is very important. Monitor glucose before and after meals to see effects of different meals on blood sugar control. Aim for regular balanced meals, and again, every 3 to 4 hours, spacing them apart, using some portion control tips like estimating portions based on plate size and plate sections or the hand size. And of course, we've mentioned choosing the lower glycemic index carbohydrates, so these are the ones that will absorb with less of a spike on the blood sugar. And of course, limiting added sugars, not completely never having them, but limiting how much we have each day. So let's switch gears to palliative care nutrition. In palliative care nutrition, or end-of-life nutrition, the key focus is on minimizing food discomfort and maximizing food enjoyment. So end-of-life nutrition can help manage some of the GI symptoms and other symptoms patients may report, and our goal is really to optimize patient quality of life. We need to keep in mind that food is important to our patients for many reasons, not just nourishment, but also connection and memories and nostalgia. It's linked with special events in our lives, special milestones. So it's very important that we work together with our patient and their families to ensure our patient is getting the foods they thoroughly enjoy. Some of the drinking and eating challenges we see at end-of-life care have a lot to do with appetite, as well as managing pain and nausea. Medication interactions can have profound effects on nutritional intake. It can lead to sore throats, swallowing, issues, difficulty chewing and swallowing safely, and of course the GI changes with aging. In addition, many folks at the end of life are dealing with tremendous fatigue. There could be social loneliness as well. So many factors can impact on someone's desire to eat. So as I mentioned, when it comes to palliative nutrition, we really have the four goals: to minimize symptoms or manage symptoms, to maximize food enjoyment, to help maintain weight or prevent further weight loss, and to improve energy levels if we can. So some strategies that we commonly use, again, each individual will be different, but these are some ideas you may find useful for many of the patients. One is spreading out the meals, so making them a bit smaller, spreading them out so it's 5 or 6 smaller meals each day instead of 3 regular meals and a small snack. Again, a focus on choosing the foods that matter to that individual. What are their favorite foods? What are the foods that have meaning to them? Have snacks easily available so when they do feel a little bit hungrier, their snacks are able to be picked up easily and eaten. Again, we can also add oral nutrition supplements. There's different strategies we use either after meals or in between meals. We want to focus on the foods that give high energy, high protein, so things like milk, eggs, cheese, peanut butters, things that the patient enjoys but are high protein foods. And of course, adding those extra calories in terms of adding either healthy fats to the meal or adding extra protein to the meal. Enjoying desserts. Desserts are fine. We want to make sure they're the desserts that the individual does like. And of course, eating with others always stimulates appetite a little bit more. So eating with friends or loved ones may also help with intake. So if you have more questions, I encourage you to reach out to a variety of different resources. I've listed a few here for you. One is dietitians.ca, Dietitians of Canada, and unlockfood.ca, which is another website from Dietitians of Canada, as well as their recipes at www.cookspiration.com. If you're interested in diabetes information, our national organization, Diabetes Canada, linked here with diabetes.ca, has wonderful resources for you. Of course, you can always email the dietitians at the Hamilton Family Health Team if you have a nutrition question, and we will try to answer and point you in the right direction to other resources. And then, of course, we encourage all of you to check in with your doctor's office to see if you have access to a dietitian so that you can meet with them for one-on-one counseling if that's what you're interested in. Or, of course, if the patients that you're working with have access to a dietitian and need that extra support, encourage them to connect with their family doctor's office. So thank you very much for your attention, and now we'll have some time for some questions.